Hi, welcome to Rope In Mental Health. I'm Garrett Kennedy, mental health consultant. I'd like to talk today about hope. What is hope? I mean, I use hope as an indicator of mental health, to be honest with you. Hope is really difficult to explain. The best meme I've come across when I'm feeling a little low, when I'm feeling a little blue, is that hope is the feeling that this feeling won't last forever. Well, isn't that nice if you're feeling bad? Not so great if you're feeling good. But to me, hope is the belief that you will succeed in a goal. I think that whatever goal you set yourself, whether it's to win or to have higher sales or to do better in golf, I mean, whatever goal you set for yourself is what you hope will happen. Now, hope is a part of mental health, that's unquestioning, and it's an essential part of success. You have to have that drive, that will, that spirit to win. You have to have a belief that your physical strength is enough, that your mental abilities make you capable and competent, and you have to have all 5 elements of a mental resiliency program working for you. Right from a strong community to a good social network supporting you, all the way through good problem-solving skills, and of course, the emotional regulation and sensitivity that is crucial for in that moment of doubt, in that moment that there is evidence to the contrary of your success. You have to have the team spirit to say, we will survive. We will not only survive, but we will succeed. That's what hope is. Hope is based on a belief, and that's where a lot of people start to struggle with it. Because when the naysayers start coming in and people are contradicting what they believe with evidence that you truly believe to be contradictory to your success, you still have to have the fortitude, the resiliency to stand up and say, no, I believe in myself, I am confident in my team, and I believe that we can succeed. Well, the whole problem with this situation is that is self-confidence. And if somebody's struggling with mental health, one of the first signs is that hope can be lost. And hope is such a difficult thing to find. I mean, being intangible and all, nothing you can see, nothing you can hear, nothing that you can experience in amongst your physical senses in any way does hope exist. Hope is purely, in essence, an emotion of the mind. And it really is of that part between brain and self, that entity, that it's not physical, it's not quite psychological, it's not quite emotional, it's the spiritual health of a person, the spiritual health of a school or a corporation. You want to see school spirit, by the way, talk to somebody from Yale, ask them to sing the song, Harvard too. They're very proud. They have a lot of school spirit, and it's that spiritual health that drives the confidence to succeed. So when you're feeling a lot of hope, it's something that you really don't look for. And when you need a lot of hope, it's something you can't look for or seek out. Hope is something that needs to be built into the mental resiliency of a workforce. The hope that we will succeed in the new changes coming. The hope that we will top our last quarter. The hope that we will be safer. The hope that we will live through the day. The hope can be gained and lost. And when it's lost, it can get bad. And if you've completely lost your hope and you feel truly hopeless, please do tell a loved one or your family doctor that's a serious mental health concern. It's one of those things you look for in mental health first aid. But what I'm looking at is not the first aid of mental health. What I'm looking at is the proactive. What are we going to do to prevent a mental health first aid attendant from ever using their skills? It's the same thing that we do in physical health for first aid attendants. Put all this safety stuff in and ruin the safety guy's day to make sure he can't use his first aid, right? Well, we want to do the same thing with mental health. We want to bring a proactive nature Now, the nice thing about all the mental resiliency and hope building is you really do build self-confidence of every employee and every person in your social network, including yourself. Mental resiliency is something that we should start talking about. Hope is something I hope that we never lose. And my kids are going to give me trouble for that one, for using a word in its own definition. But anyway, hope, faith, spirit, spiritual health, spirituality, and motivation. These are somewhat synonymous terms. We have to start addressing the spiritual health of our country, of our neighborhood, of each other, and see the mental health issues that are going around you and try to do something to prevent it. Share mental resiliency skills. They're quite simple. They're quite easy. Find a trainer that you get along with in your area and start spreading some really good mental resiliency skills. Thank you very much again for listening to Rope In Mental Health. My name's Garrett Kennedy. Give me a like and a share. Give me a message over on Facebook there at Kennedy Consulting, Mental Resiliency Training. And I hope you guys have a great day.